So how is IFS different from other types of therapy? And I'm talking specifically about talk therapy. So what is talk therapy? Talk therapy is basically a conversation between therapist and client. Internal family systems isn't really a conversation. You're not exchanging information with the therapist. There's something more going on. In talk therapy, maybe the client is either lying on a couch or on just kind of upright sitting talking to the therapist, and they're just exchanging points of view, looking for an insight, looking for some sort of breakthrough of an aha moment. Whereas in IFS, what would this typically look like? You would have maybe the client with their eyes closed and holding one hand to their chest and just going inside and feeling and kind of narrating what's going on so the other person can guide them, and maybe even holding some silence. Maybe you'd have maybe 5 minutes of silence while they just feel their body. So there's definitely something different going on. It's not just a conversation. And what's interesting about that and what makes it more profound isn't really just what's being done, but really what is underneath that. What's the rationale? Why are we not having a conversation? And the reason is we understand how healing happens differently, and we understand what a person is also from a different point of view. From the point of view of IFS, we're not just trying to make somebody's lifestyle better. So we're not just trying to help them cope so you have a better life with less suffering. It's more profound than that. This idea that life should be pleasant and that it should be like gratifying, usually to any extent possible, is actually a very modern concept. It's like, you can buy your way through life and just make things easier and more comfortable for you, and that's like the ideal life where everything is just easy and comfortable and everything is laid out. Whereas in IFS, you understand that there is a transcendent nature in the core of every person, right? That's what they call the self. It's at the essence of our being, right? And everybody has it. And this self is looking, so to speak, to witness and validate every single part of us, right? And even the ones that are in pain. So this means we're not just looking to cope, we're not just looking to build strategies that will help us avoid the pain, we're not just looking to find ways to improve our quality of life. What we're doing is we're looking to find those parts in pain so that we can validate that part and, so to speak, invite it into the present moment so that it can enjoy whatever's happening in our life without having to make our life perfect, without having to make our life comfortable, without having to make our life, we can choose to do so if we want, but that's not the point of the therapy. The point of the therapy is precisely to find those parts that are in pain and to bring them up to the surface. Of course, we do that in a very gentle and nuanced way. It's a step-by-step process that evolves gradually. It's not like, okay, you're here to feel your pain, just feel all your pain at once, so we're done with it and just get it over with so that you're on the other side now, right? So this is what Jeff Foster talks about when he says your pain doesn't want to be healed, it wants to be held. Why does he say that? Because if we're looking to heal our pain quickly to get it over with, then we're not really sitting with our pain. We're just trying to feel it so it goes away quickly. In IFS, what we do is through the self, we invite the self with its energy, compassionate energy, curious energy, calm energy. We invite that energy to be present and witness all our hurt parts so that those hurt parts don't feel like they have to carry that burden of the pain alone. So they don't feel that they have to do it all on themselves so that we can go through life in a normal way, right? And this is the process that happens where you typically would see a person with their eyes closed going inside to feel and retrieve that hurt part. So that's the difference between other talk therapies. What we understand other talk therapies do is they don't go to the hurt part. They give you strategies and they give you tools so that you don't have to feel that hurt. Tools so that in your day-to-day life that hurt is protected, kept in a safe area so that you never accidentally bump into it and your life just kind of explodes with some symptoms and with problems, you look for ways in which you can set boundaries so the hurt is safe. You can have positive thoughts so the hurt is safe. You can have all sorts of behaviors that help that hurt to be in its own, little box, and you're safe from it. So this is a sort of introduction as to why in IFS we would say we're not doing just regular talk therapy. What we're doing is something much more along the lines of allowing our core essence to witness and heal all the hurt parts of ourselves. Hope to see you in future videos. Take care.